to the Spring 2025 Advocacy Update with Senior Vice President of Government Affairs, Miriam O'Day. Thanks, Miriam, for joining me today to talk about AARC's recent successes with the Respiratory Care Interstate Compact, the SOAR Act, and how individuals can get involved with AARC advocacy efforts. Can you give us a brief background and what progress has been made on the Respiratory Care Interstate Compact?
Sure. So first of all, thank you for having me. So to begin with, starting to talk about the Respiratory Care Interstate Compact, what I really love to talk about with this project is that not only do we have the end goal of putting together a professional interstate compact for respiratory care, but that this is a really great partnership. This is a partnership between the AARC, our state affiliates, and the Department of Defense, who has funded this project, and the Council for State Governments, who has a whole division focused on compacts. So the benefit of having this kind of partnership is DoD is very wedded to this idea of interstate compacts because they're concerned about military spouses when they relocate or when their spouse is deployed, who's in the military, that they will be able to work. And they found out when they surveyed their population that about 32% of military spouses require some type of state licensure to be able to be employed. And many of these families depend on two paychecks to be able to make it day to day. So this is a very important project to the Department of Defense. The Council of State Governments is working on a whole host of professional interstate compacts. So when we decide to go into a state and launch the legislation, what happens is the Council of State Governments has experience with how compacts have successfully passed in that state or what some of the roadblocks may be. They can help us identify sponsors at the level of the state legislature. Now, I think it's important to remember that an interstate compact is, in fact, a contract that the states are making with one another. They're entering into this contract saying that they will recognize another state's licensure and their requirements and meet minimum requirements together through this contract. So once we have 7 states that have entered into this contract, in other words, they have passed the state legislation, had it signed by the governor, then we have the trigger that establishes the commission. And when the commission is set up, that's when the interstate compact really kicks in. That's when we have the provider database, we have oversight, we have rules and regulations, we have a commission, a board that will have oversight over this professional respiratory care compact. To date, we have 3 states that have passed the legislation. Washington State was the first, and then we had Alabama and Iowa. We still have 2 states that have the legislation pending that could possibly pass in this session of the state legislatures. Now, one of the things I think you have to remember is the states don't necessarily have year-long sessions. Many of their sessions end in the early spring, or certainly they're over by summer. We've made phenomenal progress in terms of being able to talk to the state legislators about the compact and having our actual legislation reviewed. So we have a number that are set up that as soon as we do the pre-filings in November or December, we'll be ready to introduce the legislation in 2026. I'm confident that we will have 7 states within the legislative sessions in the states in 2026 pass the legislation, and we will be setting up our commission, I think, sometime in the summer. One of the exciting things that's happening is the Department of Defense is funding, and our partnership with the Council of State Governments and the AARC will be having a legislative policy summit in the summer, in August, in Washington, D.C. What happens at that summit is we will invite state legislators to come and hear about respiratory care and about the compact, and we'll also be inviting some of the representatives from our state affiliates. It is a critical partnership with our state affiliates because going to these hearings and listening to what the state legislators are asking about the compact, about the RCIC, they have three basic questions. Their question is this something that is supported by the respiratory care practitioners that are practicing in the state? So it's very important to them to know that this is not just DOD, Council of State Governments, American Association for Respiratory Care, but it is actually the practitioners in the state, that our state affiliate engagement is essential. The second question that they ask is, what is the cost? And so far, the cost estimates that have been done for this legislation have been around or under $10,000. And those charges are primarily for setting up IT for database establishment. And then the third question that they want to know is what other states are participating. And so far, we've been able to tell them that we're just in the beginning of setting up our compacts, and that we don't have many states who have joined us yet, because this is the beginning of this project. I think that another important component about the RCIC, which individual practitioners need to know about, is if your state is one of the states that's participated in the compact, you will have a choice when you apply for your license. You can apply for a home state license, or you can apply for a compact license. So if you've worked at a hospital for many, many years, you have no intention of practicing out of state or doing any telehealth, you would just want to go and get the same license you've always had, which would be your state license. If you want to be a traveler, if you want to practice telehealth or work for a telehealth company, then you would have the option of purchasing a compact license in your state. Again, if your state is participating. We have put a heat map onto our website so that individuals can go and they can take a look and see what the status of their state is in their engagement in the compact. And we've tried to keep that up to date, but it's been challenging because every time we update and post the chart, something changes. And that's a really good thing, because it shows that this project is moving forward, that this is really something that is very, very attractive to our membership and to our affiliates, and that we have a lot of engagement.
What do you think has helped the shift, the trajectory of the RCIC and getting it implemented?
Yeah, I think that it is absolutely the engagement of the individual practitioners and the state affiliates, but I also think it's the partnership and that we have made this turnkey. For instance, we have states that have professional and paid lobbyists. We have states that don't. And this legislation has passed in states where we don't have a paid lobbyist. So we have really packaged this up in a way that the legislation is already drafted, the supporting documents are already there. And as I said, the benefit of the partnership with the Council of State Governments is they've worked on other professional compacts in many states. And so state legislators know what a compact is. So we don't have to, we're not starting at ground zero, right? We don't have to go in and explain what an interstate compact is. Now, the ongoing education will always be necessary for our practitioners and for our members, but for the state legislators, they're very tuned in and aware of what a compact is, because there have been other professional compacts that have come before them.
Moving on, can you give us a status of the key objectives and provisions of the Supplemental Oxygen Access Reform Act, or SOAR, and what the next steps are in 2025 for that?
So let me talk a little bit about SOAR. I think most people are aware, but just to recap, SOAR is the project of a large coalition. So we have every stakeholder in supplemental oxygen at the table with us as a coalition partner. So we have the patients and patient organizations. We have the practitioners. We have physicians, allied health like respiratory therapists. We have the durable medical equipment industry. We have both of their trade associations, both their large trade association and their small trade association that represents the small owners of durable medical equipment. And so every stakeholder is at the table for this initiative. And there are 4 pillars of reform. And each pillar addresses something that the individual stakeholder group has wanted. So the first pillar of reform is a patient bill of rights and gives patient protections. This is something the patients really wanted. So they're more aware of what their rights are within the system, within Medicare, and within oxygen payment and access. The second is something that we hope will stimulate liquid oxygen back into existence, and that is an add-on payment for liquid oxygen. The third pillar is recognizes respiratory therapists and the need to have them in a home setting to be able to go out and do patient education and evaluation, titration, make sure that the equipment matches the individuals. Because a lot of times people are discharged from the hospital to the home without anybody seeing them who's a practitioner like respiratory therapists. So the third pillar recognizes respiratory therapists. And then the fourth pillar of reform standardizes the ordering template. So now if there's a question about fraud and abuse, or there's a question about the physician orders, we have to go back through the medical records or back through the physician orders. Sometimes they're handwritten orders in the chart. And now we'll have a standardized order form. One of the things that I like to talk about with that standardized ordering form is that it actually gives physicians a menu of what they can order, because respiratory therapists know they're experts in this area. They may have more understanding of what those portable concentrators look like, what some of the oxygen equipment actually looks like. They've been hands-on with it, and many physicians have not. So the standardized template will give the physicians what they can choose when they're discharging a patient from the hospital specifically. So those four pillars of reform remain in the reintroduced legislation, and our effort now is to continue to build co-sponsorship. We're starting off with the committees of jurisdiction, and those are the committees that would vote on and have a hearing and in committee mark up the legislation. So it's Energy and Commerce and Ways and Means in the House and the Finance Committee in the Senate. And then we also want additional broader co-sponsorship just to show that this idea, this concept of Medicare oxygen payment reform is popular among members of Congress, because we know right now in this day and age, and actually for several years, probably more than 5, maybe 10 years, we haven't had a lot of standalone pieces of legislation that pass. So most likely this piece of legislation will have to attach to what we call a vehicle, another piece of legislation that's moving through Congress. So the greater number of members that we have who have co-sponsored this legislation, the greater chance we have to attach to something, because we show how many people actually support the SOAR Act. So that's what we're working on now. The legislation was reintroduced. It still honors the four pillars and stays essentially exactly the same as in the past. There have been some small changes that have taken place with the legislation that are enhancements in AARC's opinion, and getting co-sponsorship will really help us when the time comes where we may be able to attach to a vehicle to get the legislation passed, to show that we have a lot of support.
Along with the support, what role did advocacy groups and stakeholders and all the experts play in shaping the content and the scope of the SOAR Act?
Yeah. So as I said, the four pillars are really based on coalition members and giving something to every stakeholder who is at the table. I think it's important to really remember that while respiratory therapists have an add-on payment in this legislation, this is really legislation that grew out of the needs of patient access. Patients have, according to the durable medical equipment industry, gotten what they need at home, but the reduction in portable systems and in liquid oxygen access have really trapped them in their homes in some cases. And what we're looking for is redefining the oxygen as supplemental oxygen instead of just home oxygen, so that we have portability and that patients are able to get out of their homes, have a better quality of life, and have better health outcomes. And for those patients who need it, liquid oxygen is essential, because the other pieces of equipment don't always deliver the higher flow rates that those patients need, the sickest of the patients.
What have been some of the reactions and responses from the public and the media and the other stakeholders on the SOAR Act?
So we have, in the last session of Congress, we didn't make it getting attached to a final piece of legislation, but we had great coverage in some earned media. We had letters to the editor. We had some great coverage in the local press, and we had a great piece of coverage when the respiratory therapists were in Orlando for our annual Congress. We had a patient who was interviewed in the Orlando Sentinel and talked about COPD and the SOAR Act. So we've had really good press coverage. I think that, there is always an opportunity to amplify voices. When I think about respiratory therapists and how enthusiastic and engaged they are in advocacy, and then I think about the patients and how ill some of the patients can be, I think this is a great opportunity to partner up with patients and have some in-district meetings come August. So we're going to run a big campaign prior to the August recess to partner respiratory therapists with patients. We're working closely with the COPD Foundation and our other patient partners in making sure that we can get them out to meet in the districts with their members of Congress. And really by the time that the fall comes around after the August recess, get some great co-sponsors onto our legislation and be there if there's a vehicle that's moving at the end of the year.
Sounds good. I hope we can make all that happen. What other respiratory care advocacy efforts has AARC been involved in 2025 so far?
So there are a number of regulatory comments that we've weighed in on. In the big picture, we're not blind to what's happened in terms of some of the cuts in personnel and funding for health and science research, especially. And so we have signed on to a number of letters with our coalition partners asking that they continue, that even though we've had cuts in specific areas in personnel or funding, that the government continue to provide the services that those offices provided. So we're not opposed to reorganization or change. However, we want to make sure that when this change is taking place, that some of the education programs, for instance, the asthma educator program, the education program that was at the NIH, the Learn More, Breathe Better campaign that focused on COPD, that those activities of those offices don't go away. And so we're waiting to see, as the appropriations process moves forward, what happens with some of those functions. So while they may have eliminated some personnel and some funding, we've signed on with our coalition partners, including the Ad Hoc Group for Medical Research. The Research America has done tremendous work, and the Partnership for Tobacco-Free Kids and the Tobacco Coalition, we've signed on to a number of letters that address those issues. In addition to that, there's regulatory process that's moving forward on a number of key issues that are important to the way that respiratory therapists practice. And if it's appropriate, we partner, for instance, on the NIV issue, we partnered with the ATS and CHEST, and we collaborated between the three groups on what our comments were so they were consistent to CMS about oversight.
How can AARC members and our advocates get involved with all these efforts?
When we send out action alerts, we hope that you will take action and share those action alerts on your social media or with your friends, your network, your neighbors. In the case of hospital employees, we hope that you would share those action alerts with your department and make others aware of them. So that's an easy way. That's a 1 or 2 button click to send a letter to your members of Congress. We hope that if we reach out to you after you've taken action, that you will get engaged in sending a letter to specific personal staff in congressional offices. And sometimes we do that. We reach out and ask people if they will send another letter to personal staff in those offices. In addition to that, we hope that when we launch our campaign to do the August recess, that you'll engage. With regards to the state legislation and the Respiratory Care Interstate Compact, we've had a lot of success. We've reached out to the members who are on our state mailing list and asked them to weigh in with the state legislature. And I can tell you, before a hearing took place in Washington state, we had 229 individuals that signed in before a hearing that they were in support of the legislation. That's huge for a piece of state legislation for a small issue like ours. So we just hope that you will join us when we reach out to you. We hope that you'll continue to go to the AARC's website. We hope that you will sign up to receive our action alerts, and that when you receive those action alerts, you not only take action, but share it in your network and on social media.
On a similar note, when is the annual Respiratory Care Washington, D.C. fly-in, and why is that so important for our advocacy efforts?
So that happens in September. I can tell you last year we had a terrific turnout. We had over 100 advocates who were there. They had 240 meetings in one day, which is reaching about, almost half of Congress in one day. And it's critical because people need to see the practitioners. They need to see respiratory therapists. They need to really understand from the perspective of somebody who is in clinical care or who is an educator the importance of a number of these things that we're asking for. The other thing that I'd like to tell people who are interested in advocacy is there are people asking for something every day. And if you aren't there asking for what your needs are and for recognition for the profession, then they're not going to do it for you. Also, what's good for the respiratory therapist is really good for the patient. So the more that patients have access to specially trained practitioners like respiratory therapists, the better their outcomes are. We know this. One of the other things that I probably should have mentioned, which I didn't, which is that we've made a request to the Government Accounting Office that they do a study on the workforce for respiratory therapists. So we'll really be using that study once they approve it, and we think that they will, to really leverage recognition of respiratory therapists within the federal government. And those types of things really help us move our agenda forward.
That's great. Is there anything else you'd like to share about what's going on this spring in our advocacy efforts?
I'm really excited that I've been getting out and going to some of the affiliate conferences and having an opportunity to talk. Also, I know President Evans has been out. She loves to talk about advocacy. She's really enthusiastic about this topic. One of the things that President Evans has done is she's got a QR code in her slide deck, and she asks people to stop, use the QR code, and actually send an action alert letter to their members of Congress while they're sitting in the meeting there. So I think that's something I'm going to start trying to do when I get out and talk. I'm looking forward to going to the meeting for the Florida State Respiratory Care. Also be going to Arkansas and Hawaii, and really looking forward to working closely with our practitioners. I've already been to Oregon, and the more I get out and talk to our membership, the more I learn and the more we can engage together. So it's absolutely terrific. And you will see us online. You will see us in your social media feed, and we hope that you'll join us in taking action.
Thanks, Miriam, for joining us today and giving us this spring advocacy update. Everybody should look on the AARC website at www.aarc.org and click on the advocacy tab and get involved. Thanks so much.